Cheek fillers, what are they? Who has them, and why do we want to have them? So one of the most common reasons people come into my practice is to have augmentation either in the lower eyelids or the cheeks to help fill and volumize areas that may have lost volume. And the fillers that I predominantly use in these areas are hyaluronic acid fillers. The reason for that is that they're, one, reversible, and two, they are temporary. They last anywhere between 12 and 24 months depending on the type of filler that's used. In my opinion, hyaluronic acid is the perfect treatment to augment the area of the cheek and different parts of the face. And oftentimes, in order to create a more harmonious appearance to the face, you not only have to inject the cheek area, but you may need to go into the maxilla, you may need to go into the chin, the pre-jowl sulcus. You may need to tweak a number of different areas to get the best aesthetic outcome. It's always in the best interest of the patient to have less, and it's always easier to add more at a later stage. What are the complications with hyaluronic acid fillers? So, obviously, any sort of injection implies that there could be bruising and swelling as a result of the injection. There are other issues that can arise, however. You can have too much filler in an area, and depending on where it's injected, it can manifest itself as swelling in the eye area, for instance. Sometimes you can actually see the placement of the filler if it's done too superficially. Sometimes you can have lumps and bumps if it's, again, not done in the correct plane, or if there's too much filler injected into the area. And then there are more serious complications. I always tell my patients there is always the risk of having necrosis of the skin, which means you can have some of the tissue dying because of lack of blood supply to the area. And there is a very small risk that blindness can happen with an injection of any filler, dermal filler, on the face. So in the event that you have a complication or do not like the aesthetic outcome of hyaluronic acid fillers, there is a way to remove them or dissolve them. It is called hyaluronidase. Generally, this is used as a last resort in the event of a complication. So if you have some sort of tissue necrosis, or you have another medical issue that's happening, we tend to use hyaluronidase. And as I said, this is an injection. It's similar to more like a botulinum toxin injection because it's a very small needle that's used to place hyaluronidase, which is an enzyme that helps dissolve the hyaluronic acid. It works immediately. So within 24 hours, you will have some of the hyaluronic acid filler dissolved. It is not a precise science, so imagine that you have filler in the form of an ice cube and you put hot water on top of it, and the hot water melts the ice cube. Hyaluronidase works in a similar fashion. Wherever hyaluronic acid it touches, it melts it in that area. If you don't inject into the area that has the hyaluronic acid, then that hyaluronic acid will remain. Sometimes you may need more than one treatment in order to dissolve all the hyaluronic acid that you'd like to remove. It's really important to do your research in your injector and the doctor who is going to treat you. One is to have the proper expectation. Two is to have their expertise in how to treat those areas while maintaining harmony in your face and creating a better version of yourself as opposed to a different version of yourself. Three, you want somebody who is going to be conservative. As I said, there's always the chance to do more. Four, you want somebody who, in the unlikely event that you are to have a complication, to be able to manage that effectively and well and give you the best long-term outcome possible. However, it's really important to know that there are limitations to hyaluronic acid, and if you need excessive amounts, then sometimes you should consider surgical options that would be a better long-term fit and result for your face.